Yeah, let's go.
Every time you see my face on your screens, you always know that it is time for health discussion. So welcome on board. Today, I want us to talk about postpartum depression or the afterbirth depression. So send in your views, share the content, and share with us your experience with postpartum depression. This is the Health Nuggets, and this is your reporter Patricia Duku, the usual Bliss Health reporter.
Yeah, let's go.
Our society today, the resultant effect of postpartum depression has been felt by a good percentage of the members in our society. Most go through postpartum depression without understanding that they are through it, while others actually suffer from postpartum depression knowingly but fear the stigma of sourcing medical attention. So when we are talking about postpartum depression, the sad reality of it is that around 90% of our mothers or members of the society go through postpartum depression without their knowledge. It should also be brought to attention that postpartum depression does not only affect the pregnant women and women who have already given birth, but the effect of the depression surpasses all the way to the husbands or fathers of the children, to the children who are born in the family, and the effect can also be had by members of the society around the postpartum victim. According to data by the Ministry of Health Kenya, is that in every 100 successful births in Kenya in our hospitals, around 20 of those women actually suffer from postpartum depression. But it is unfortunate that in this, around 10 of these women suffer from the mild depression and do not understand that they are going through postpartum depression, and most of them actually understand their situation when they get to severe stages. The other 10 women go through postpartum depression knowingly, and most source medical attention. When it comes to men, the number of men who actually source help when it comes to postpartum depression is still minimal, and this creates an alarm that we need to alert our men that postpartum depression exists, and it's time they start seeking manageable ways to postpartum depression. Children also undergo postpartum depression, and you will notice that this effect is highly prevalent to the children who are exposed in a postpartum depression environment, and they tend to actually start withdrawing from their normal activities, and they start caging themselves inwards, and they exempt themselves from their normal daily activities. Unfortunately, postpartum depression gets to critical stages where mothers kill their children, leave homes, fathers leave their families, or children just get abnormal growth patterns from what they were experiencing as normal growth patterns. When we are in a postpartum depression discussion, I want to also highlight on the stigma that it is associated with. You'll notice that in all the postpartum depression cases, the number of men who show up for care is very minimal. The number of women who suffer from postpartum depression get withdrawn due to the stigma that comes along with being a postpartum depression victim. And it is time that the society starts appreciating postpartum victims, as this is a condition that can be cured and the victims can go back to normal. And also, this condition is not a choice, as most people tend to make claims like other women have also given birth and they didn't go through this. So it is time that people understand that births are different, women are different, bodies are different, families are different, and reactions to birth differ from one family to the other. And on this discussion, we decided to approach a medical practitioner who will take us through postpartum discussion.
Yeah, let's go.
My name is Dr. Ngotho. I'm a gynecologist.
Thank you so much, Dr. for taking part in this discussion on postpartum depression. And just to kick us off, do you mind giving us a professional understanding or medical description of what postpartum depression is?
Postpartum depression is a situation where after delivery because of various reasons, a mother will change from self into a withdrawal type of situation where they really get very low in terms of who they think they are and really live in a world of their own, so to speak. They're very low, they're very sort of like disappointed. They are not themselves. They are lower than what you'd expect.
So when we are talking about some of the symptoms of postpartum depression, you'll notice that some of the symptoms that patients with postpartum depict tend to look similar as those of other types of depression, for example, killing themselves. Other types of symptoms are, for example, being lazy and getting withdrawn from the normal activities and engagements with the public. The major effect of postpartum depression is actually felt by almost every member of the society, and the root cause of postpartum depression is not yet to be brought out, since you notice that postpartum depression does not have any particular sequence or any particular format by which it attacks its patient. You'll notice that some of the patients who suffer from postpartum depression actually get it early on the early days of their pregnancy, while others enjoy very soft pregnancies and start getting the postpartum depression complications later on into their pregnancy, while others actually get the postpartum depression when they have already given birth to their young ones.
Pregnancy itself is basically what we call a developmental crisis, so that when one is not pregnant, they do not appreciate a number of changes that do occur to a pregnant mother. A pregnant mother has hormonal changes, she has also physical changes, she has social changes, she has psychological changes, and therefore because of all those put together, and especially if they have had in the past experience of different situations, it can make them become depressed, because there are other changes that they can have, but one of them is that they can become depressed. On the other hand, the men, especially when it is the first child, they have not been used to a child in their own home. Now they've changed from being just another man to a husband and also a father. That they're not used, for example, to a child crying throughout the night. They're not used to dynamics of the home that are brought by a newborn, and consequently it may influence them, especially, for example, if they were to go to be going to work in the morning, and then they have not been able to sleep. It can also influence them significantly, and quite a number has been found about the first pregnancy. 1 out of 10 men may actually become depressed.
Postpartum depression, however, has a number of symptoms, and the most unique character to do with postpartum depression is that this type of depression only exists in an environment where we are talking about a child. Either a child is on the way coming, or this child has already been born. And postpartum being the wider dimension, it should be brought to attention that postpartum depression actually has 3 major phases where patients go through, and in each phase, the patients depict different characteristics and symptoms from each phase, as Dr. Ray explains.
It falls within what we call the psychosis, and in psychosis there are 3. There is what we call the mania, there is what we call the depression, and there is also what we call schizophrenia. Now, in terms of the depression, one of the things is, first of all, there is the element of denial. There is that element of withdrawal. There is that element of feeling unwanted. There's that element, therefore, of withdrawal. Sleep pattern is altered. They may not even eat properly. they may actually have a lot of anxiety sometimes. At times, they may have, they just may be tired, they feel tired, and times they, as I've said before, they lose appetite, and quite sometimes they may be so persuaded by the situation that they may actually have the feel to kill the baby, and they can themselves commit suicide. So it's a situation where it's in essence an extreme in terms of a lot of symptomatology, in terms of negativity about that particular individual. But as I've said, of the three, the schizophrenia, the mania, and the depression is the most dangerous today.
Postpartum depression is curable, and any person who's suffering from postpartum depression should actually not feel withdrawn or actually suffer from the stigma that comes along with it. We have a number of treatment methodologies for postpartum, and each method is different, and the different approaches keep differing according to the environment that one is exposed to.
There is the electric shock therapy, there is the psychotherapy, there is also a very important part that is played by the family, and especially the nuclear family, in making her come out of that situation. Other than that, of course, there are antidepressants that are also used.
Daktari also has a take-home note for all of us that I should bring to your attention.
Support by the husband is key. Support by the immediate family is key. And certainly the social support is paramount. That is very, very important. Let's not assume that pregnancy is a cup of tea. No, it is not a cup of tea. It is a tough journey that needs support by one and everyone around.
With the knowledge impacted from this desk, I hope that you also go out there and handle postpartum depression cases and victims with the care they deserve. I have been your host, Patricia Doku, and until next time, do us meet. Have an awesome week.
Now let's go.